We get massive weight loss after our surgery, okay? What kind of body tissue are you losing when you lose all that weight? Well, what we want is fat. But exactly as your question and your friend brought up, unfortunately, the heavy person's body is not good at burning fat. So against our wishes, against your best interest, your body burns a lot of muscle. It shouldn't. We don't want it to. It's not what it should do. We're angry about it, but your body's not good at burning fat, otherwise you wouldn't be heavy. So one thing your friend suggested is, why don't we give you illegal hormones? Okay? We could find Barry Bonds' doctor, maybe, you know, and give you, or maybe I could make money doing that, right? Give you illegal testosterone and human growth hormone, or you mentioned HCG, and maybe you could do those things, but they're, in our society, they're known as what we call illegal. And it might work, but it's not been approved by any scientific body, so giving our patients testosterone, growth hormone, and things like that is not appropriate. Now, a couple of doctors have looked into it under scientific studies, and there is some potential justification. If you just think about it in your mind, maybe you would be better as a starving patient if you got some growth hormone and some testosterone and some HCG. But that's theoretical, and it's illegal. So I'm not planning on doing that. But if you find a doctor who can do that, you'll probably be in Tijuana, and you'll want to be real careful about those medicines. But it does make sense that there's hormonal abnormalities that have made people heavy in the first place, and maybe if we could get in there and get just the right mix, maybe you wouldn't even have to have surgery. If we could find just the right mix of hormones, the HCG and growth hormone, testosterone, maybe we could fix it. Right now, there's no legal mix like that. You know that football players, baseball players, people do abuse illegal steroids and use them illegally. And that might work in our patients post-op, but we don't do that.